It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives, changing lives, changing lives for the better, changing lives.
Good morning, everyone. I'm Grace Sells, and welcome back to another edition of Best Docs Network, the show that's featuring some of the best doctors in the Houston area that are really changing people's lives. Let's go ahead and get today's show started with interventional cardiologist, Dr. Annie Varghese.
As you get older, sometimes you have trouble finding words. So my daughter got all worried, so she'd maybe go to a neurologist. So he does his thing, go back later, he said, it looks like you had a couple small strokes. They're small, they're not gonna bother you. But, he says, you need to go to a cardiologist to check out your heart, just to be on the safe side.
Valvular heart disease encompasses many different entities. The heart has 4 different valves, and Gary Singerman had actually infection and rupture of his mitral valve, which is a very important valve separating the top and bottom chamber of the left side of the heart.
So she sent me to Houston Northwest Hospital, where she had them ordered ultrasound for me. And I feel fine. Can I go home now? So my wife and I are sitting there, and she comes in with this film of the ultrasound. She says, could you see the mitral valve there? I said, no, I'm not trained for that. So she points with it to her pen and says, right there, it's hanging down in the ventricle. It's been ruined with the bacteria, and it's not doing anything. And so she says, within a month, you're gonna have a massive heart failure. And I heard my wife gasp, and I got rocked. Wait a minute, I feel fine. She said, I'm checking you into the hospital right now.
Mr. Singerman had mitral valve prolapse, therefore the valve was not closing properly, was redundant and thick, and therefore it was easy for bacteria to stick to that valve and cause infection. And this happened before I met him, and his story is quite interesting, how he came to me. He immediately needed surgery because his valve was infected and ruptured and not working at all. But he's very thankful that he came because we were able to save him.
Obviously, I lived, but the point is I may not have if Dr. Varghese hadn't caught that ruined mitral valve, and so I owe her.
Yeah, I lost a couple, and the rest of them started getting loose, and it was something that took about 5 or 6 years to happen. It just suddenly came on, though.
Yeah, George, his teeth were in an end stage in that they were decayed, and he also had periodontal disease, bone loss around his teeth. His teeth were chronically infected. They had become loose. Also, there was a cosmetic problem with his teeth, and George is a very outgoing person and likes to smile and has a great smile, and so his smile just didn't suit his character, not to mention the health of his teeth. It was really driving him down.
I was kind of getting to the point where things that required real chewing, particularly in the back of my mouth, was getting more and more difficult.
With George, what we did was removed his teeth. Now in him, we focused on his lower jaw. And from a financial standpoint, many individuals decide to maybe focus in one jaw versus the other. Now granted, with him, we could have done both of them simultaneously, but for whatever reason, and oftentimes it's schedules, their busy work schedule, also finances, that they'll sometimes stagger the case to suit them better. And with George, we focused in his lower jaw and we removed all of his teeth, upper and lower, but we put the implants immediately in his lower jaw.
I'm feeling fine now. I'm back to the point of eating anything. There's no problem. We're continuing on. I'm not quite through with all the procedure, but just about.
And that is a misconception that we're seeing right now with the advertising, where it talks about get this all done and completed in one day. Reality is the final is usually done later down the road once the body has fused to the implants. And the textbook answer for that is at least 3 months, but it can be as long as anywhere from 3 to 6 months. But the standard of care is to keep the patient in a provisional, a prototype, if you will, for a period of at least 3 months.
According to my experience, no question about it. Don't be waiting on it. The earlier you start some treatment, clearly the better.
We all get cuts and may need stitches. How can you tell when a cut that you have somewhere on your body needs a stitch and when it doesn't? Well, there are several ways. One way is if it's gaping open. That's going to be obvious to you. The skin is gaping open, things look like they got to come together, and then you need to go to the emergency room or to your doctor's office. If you're having arterial bleeding, that's spurting blood that pulsates out, as opposed to vein bleeding where it just sort of leaks out. Spurting is obviously not so good. That probably needs a stitch or two. If you see that yellow fatty tissue, then you're deep enough that you're going to need stitches to make this wound heal right. Also, if the wound is over a stretched area on your body. For example, a wound on your forearm, like right here, wouldn't be a big deal to keep together with a Band-Aid. But over your elbow, where it bends and opens up with each bend, you're going to need stitches for that. So those are the things to look for. Also, just use your common sense. If it looks like it needs stitches, it probably does.
For additional medical minutes from Dr. Honaker, log on to bestdocsnetwork.com, click on Education and the Medical Minute tab.
For more information and to check out hundreds of videos, head to our website. It's bestdocsnetwork.com. Let's go ahead and take a look at our next physician, ear, nose, and throat specialist, Dr. C.T. Wynn.
I was experiencing a sinus, like an ongoing sinus infection for like the past 2 years. I was feeling congestion in my nose and ears and throat, fever, body aches, headache.
Alondra can't breathe through her nose. She feels pressure in her face, her ears, and most importantly, she had this constant postnasal drip that makes her cough all the time.
Constant feeling like you're tired. You know, you're feeling like you got to go to work, but you feel not 100%. And it would also affect my social life because I was always so tired out of feeling sick that I would just decide to just stay in and not really go out.
Upon examination, I noticed that her nasal cavity and sinus are completely blocked. She can't breathe through her nose. And decide upon a plan of treatment that consists, obviously, of allergy avoidance and allergy control combined with a turbinate coblation. It's a technology using radiofrequency to reduce the swelling of the side wall of her nose, increasing her capacity to breathe through her nose and improving her nasal allergy symptoms.
After the procedure, I no longer experienced the symptoms that I was experiencing before. I noticed that I could breathe a lot better. Like I just want to say I could breathe.
Alondra was very happy with the result of the treatment. We actually found the cause of the problem and targeted our treatment. Alondra breathed better, she feels better. It's a new person. Medicine has advanced so much that there's always a solution to breathe well and live well. Patient doesn't have to suffer anymore.
I no longer felt congestion. I wasn't getting sick every month because I no longer had that infection inside of like my sinus passages. So I want to say I feel great now.
Over 90% of diseases are caused or complicated by stress. Some ways to help deal with the stress in your life are exercising, listening to music, writing in a journal, or going for a walk.
A few years back, I started having ulcers show up on my lower ankles. So these ulcers would take 2 to 8 months to get rid of. Once those would heal over, another one would pop up.
We did an ultrasound and discovered that he had severe chronic venous insufficiency with very large varicose veins and swelling. His biggest issues were that he had open, non-healing wounds. He had a very large one on the right side, and he had a much smaller one on the left side. He'd been seen and treated by a variety of people with a variety of methods over the years. None of them had worked.
They said, well, that's not really a problem. We have surgeries that we can do on an outpatient basis. We can get rid of that for you in no time.
We very carefully mapped out which veins were bad in his legs, the ones that are running backwards, and then made sure we understood where the blood was running correctly. And we ablated selectively the bad veins to restore the venous circulation out of his legs back to normal. And that improves the overall health of the leg and improves healing, and he actually healed up very nicely.
The procedures, like I said, didn't take any time at all. Come in the morning, go to work in the afternoon, not a problem. There was no pain after the surgeries. All went well. Went back to work, no problem.
You can have wounds that are unrelated to venous insufficiency, but most chronic non-healing wounds are related to problems with your veins. But if you have a non-healing wound, that is almost certainly from venous insufficiency, and we can heal virtually all of those wounds here with the procedures we do.
Having the circulation back in my lower legs allows me to work longer. It allows me to stay on my feet longer. I don't have the foot pain that I had prior. The procedures helped dramatically.
Prevention and therapy of osteoporosis is one of Dr. Meredith Morgan's specialties. Dr. Morgan offers some suggestions that could help prevent this disease.
If a woman's normal, a healthy lifestyle should be adequate. The question about diet, nutrition, and exercise, part of life would be an active lifestyle. Weight-bearing exercise, say 5 times a week for 30 minutes, is good for cardiovascular, and it's good for the bones. So walking is great. So if a person can do that, that's the ideal for the bone health. Therapy is indicated on a risk factor. If there's been a fracture, it's obvious the disease exists. If there has not been a fracture, but the absolute risk projects to over 20% for a major fracture of the spine, arm, wrist, or a 3% 10-year risk of the hip, then drug therapy is indicated.
Dr. Morgan can adjust his treatment depending on his patient's lifestyle.
There are basically 2 groups of first-line therapy. The bisphosphonates, to use a big chemical phrase, and denosumab, which is a type of immune therapy. These have been proven to be effective and significantly reduce the risk of fracture. Highly, highly preferred to obtain our calcium in the diet. Just make it really short and easy, about 1,200 milligrams of calcium a day. In terms of nutrition, this is very serious. There is controversy, but there's enough evidence to indicate that a person who tries to treat osteoporosis only with calcium supplements or calcium and vitamin D supplements may have an associated 30% higher risk of having a coronary event, a heart attack. It's mainly theory as to why this would happen, and there are some people that don't believe it would happen, but in terms of the alternative managements of the disease or the high risk, we're talking about nutrition, supplements in a reasonable dosage, and the lifestyle of exercise and fall prevention.
the doctors that you've seen on our show today have profile pages on our website, bestdocsnetwork.com, complete with bios, photo, videos, and you even have the ability to request an appointment. And that includes our next doctor, plastic surgeon, Dr. David Altamira.
I had a double mastectomy, and they needed to round out one of the breasts with more tissue. So they took it from my stomach.
She'd always been bothered by her stomach. Her stomach was kind of bulging and out of proportion to the rest of her body. And she thought, you know, I went through this trauma with the breast cancer. Now it's time to do something nice for myself. And so she elected to go ahead and have the tummy tuck to improve the shape of her stomach.
I've had 4 children, 2 naturally and then 2 cesarean. And you start to get what would you say, a pouch and scar tissue buildup. So, you know, I'm gonna look sexy again, feel sexy.
A tummy tuck can really benefit a wide variety of people. Usually it's what we see is women who just have extra loose, saggy skin in the abdominal area. Oftentimes it's either from pregnancy or from weight gain. They've tried dieting, they've tried all the gyms and working out, and they still have that just loose, saggy skin, or that little just pooch or bulge in the lower abdomen that they just cannot get rid of.
The difference is looking at myself and not seeing a stomach protruding, where I can put on clothes and I feel good. You know, I feel sexy. You know, I can wear a bikini, where I couldn't do that since 4 children ago. So, you know, it just brings that sexiness back.
She had a dramatic improvement. Before the surgery, she had just a very thick layer of fat on her stomach. She had stretch marks, loose, bulging skin, pretty much all around her entire waistline. After the surgery, we were able to remove a great deal of skin and fat and give her a nice, smooth, flat contour. A great deal of the stretch marks were removed. Everything was nice and firm and tight once again.
Oh, after having 4 kids, I've always wanted to have a tummy tuck. I just, you know, wanted to get back to me. I got my sexy back.
Another reason to stay hydrated throughout the day is because your brain is composed of 75% water. Your brain will also begin shrinking 0.25% in mass each year after the age of 30.
How do you know the difference between having a bad cold and having allergies? It's important to know because sometimes that depends on whether you go to the doctor or not, or whether you stay home or not from work or school. Well, a bad cold is caused by a virus. So you generally have fever, you generally feel bad, you feel achy. The reason you feel achy is the viruses live in the tiny capillaries in your muscles. So in those capillaries, they swell up because the virus is there, and then you hurt. Also, you generally get chills and have generally been exposed to someone who's had similar symptoms. Allergies, you generally tend to sneeze, you don't have achiness, you don't have fever, you don't have chills, you may have itchy eyes and runny nose. Also, when you have a bad cold, your mucus, the stuff that comes out of your nose or your lungs, might be discolored, thick, yellow-green, whereas it's going to be thin, clear, and watery when you have allergies. Now, there's different ways to treat these things, especially if there's a bacteria involved. You might need antibiotics. So basically, just remember, it's fever, chills, and just feeling horrible all over. That usually means a bad cold with a virus or a bacteria, and you need to see your doctor. Otherwise, it's probably just allergies. Just get some stuff over the counter.
My symptoms are, I don't want to walk on the ball of my foot. It shoots sharp pains up my leg. I mean, it feels like a nerve's being pinched off.
Wanda is a patient that presented to my office complaining of shooting pain, down her heel, upper leg, and so immediately I started thinking maybe there's a possibility of a nerve, compression.
Told him my symptoms. He suspected what it was. He wheeled in a little mini ultrasound machine, did it right there on the spot, and diagnosed the problem. And we set up surgery because I had already tried other treatments with other doctors and it didn't work, and we were done.
This is your ankle joint, and you have a major nerve that courses through here. There's a natural tunnel. It's called your tarsal tunnel. What happens is the tunnels get real tight and they clamp on the nerve, are the protective covering, which we call the flexor retinaculum. The nerve tends to get stuck underneath it. So what happens is when the nerve gets compressed, it's extremely painful.
What he's trying to do is avoid that numbness, and for most people it works. You know, you basically take what's pinching the nerve off away, and you make room for it, and life goes on.
And the advantage of this is, like, it's not a surgery where you're really held up for a while, where you have to, you know, stay at home and you can't put weight, because I want the patient walking as soon as they can, because I don't want those tunnels to tighten up or to close up. So I want to make sure the nerves can glide. Wanda had tarsal tunnel surgery. She comes back to the office 3 to 5 days later, and just dressing change. No need for x-rays because we're not doing any bone work, which is great too, because if you're not doing bone work, it's not necessarily as painful. There's less swelling. And so 2 weeks later, sutures are out and she's walking on her own.
I'm very happy. I've actually recommended him in all my friends that have gone to him, and they've had more extensive things done to them where, you know, you're reattaching muscles and putting in screws, you know, really crazy stuff. They also think he's awesome.
The side effect that one has from nerve decompression is not pain, it's lack of sensation, it's numbness. And that's temporary because with time they regain their sensation, but it's a really easy recovery and it provides immediate relief.
Requesting an appointment with any of our amazing physicians is easy. Just head to our website, bestdocsnetwork.com, go to the doctor's profile page, and click on the Request an Appointment tab. And you can even request an appointment with our next physician, bariatric surgeon, Dr. Robert Marvin.
I kind of came to a realization that I obviously was not healthy, and it got to the point where it was kind of borderline embarrassing going shopping, and I would shop for clothes and I would cry in the dressing rooms, and I realized at that point it wasn't 5 pounds that I had put on, it wasn't 10 pounds, it was I had gained about 100 pounds without really even, I can't say I didn't know it, but I think I was kind of in a state of, well, denial.
Stephanie's lost all of her extra weight, so that's ideal. That's not, we don't expect that, we hope for that, and she's achieved that. She's achieved it because the surgery's given her a lot more control, but she's exercised that control.
I got the surgery March 5th of 2012, and currently I've lost about 115 pounds.
But she's really changed how she eats and limited it to very healthy things, natural things, local, organic things, all of which have pretty much a low glycemic index. She's cut out almost all the animal fat out of her diet, and then that's ideal.
Everything has changed. Just a different joy. My kids are proud of me, and at work, working is easier. I realized that it was absolutely the best thing that I ever did, not only for my life right at this moment, but for my life forever.
Her whole approach to eating has changed, and she's involved her family and friends and coworkers in that, and that will produce an effect known as the halo effect, which is that patient having the weight loss surgery can actually transmit better lifestyle to some of the people around them, and those people actually benefit from that.
And so everything has changed. How I saw myself, how I see myself, how I see food, how I cook, how I shop, everything. Totally, like, I feel like a totally different person.
sunscreen is unlikely to stop you from being sunburned or reduce your risk of skin cancer if it is not applied properly. Most people do not apply it correctly and stay out in the sun too long. Be sure to put plenty on and reapply often. In today's Ask the Doctor, Mark from the Woodlands has a question for Dr. Annie. Why do I need to take so many medicines for high blood pressure?
Blood pressure is regulated by multiple receptors on a cell. So if you can visualize a cell having 20 different receptors, you can realize why one medication may affect one receptor but not the others. Therefore, it's better to have multiple medications affecting many of the receptors rather than going high dose on any one medication, because high dose usually can cause side effects. So therefore, the answer to your question is multiple medications are necessary to affect multiple receptors on cardiac cells as well as vascular cells to help regulate blood pressure. Very important to take care of that blood pressure. Keep it low, protect your heart, protect your vessels, protect your life.
I found out about James through a local chiropractor who has treated a lot of wounded warriors and has worked with them and donated his time to help those guys.
On February 26, 2006, we were on a presence patrol, and we got some information that they were making IEDs in a mosque, which is a place that is the majority of the time a place where we can't go mosque in schools. But anyway, we went there, we followed the information, detained some personnel, and as we were leaving there was an SV bit on site that detonated right next to my striker. A piece of shrapnel entered through my helmet over my left ear and gave me a skull fracture, a windshield skull fracture.
He was at Walter Reed for a long time, coma, trauma, and he's made a remarkable recovery. He's self-conscious about his teeth. And it's not that they were broken up or damaged in the accident that he had, but he's studying to be a nurse practitioner. And so he's seeing people in the clinic. And so then he's going in and talking to patients and people.
I have a very stern and aggressive approach, and it's just ingrained in me after 10 years of being a ranger. That's just how you communicate. I'm learning to smile. And then I realized, growing up I was embarrassed about my smile, and when I see my patients and I don't smile, it's hard for them to, this guy is too serious for me to be treating me, he's mean.
He just had a self-consciousness about his teeth, and yes, they definitely could use veneers. He has some teeth that are real crooked and tucked in and stuff, so he's a perfect candidate.
The whole team here, they've taken me in, and I'm excited about the change because I know my demeanor is going to change as I work with my patients.
I have so much respect for these guys who go and put it on the line for our country. And my dad was wounded in the South Pacific in World War II, and I'm just a big supporter of our veterans and what they do. So I wanted to help this guy. I just wanted to, and I think he's going to get a fantastic result.
It is so great to see these doctors really making a difference in people's lives. That's going to wrap up today's episode of Best Docs Network. For more information, head to our website, bestdocsnetwork.com. And if you have a question or comment or a life-changing story, we would love to hear from you. Send us an email at info@bestdocsnetwork.com. I'll see you next week.